So next is just quick revision on breast cancer. So this question might be asked is about a mammogram and what is the most common finding in a mammogram. So look here, this is the characteristic of breast cancer in a mammogram. And the most characteristic is a speculated mass. If you see there are multiple spikes coming out from the mass in here, so we call it a speculated mass, right? And two is something called microcalcification. All of these is basically considered as microcalcifications. Great. So we've done a mammogram for the patient, and we think from having a mass that is speculated and presence of microcalcification that this might be cancer. So what will be your next step? So your next step really is to confirm or to do a definitive test that tell you that this is cancer. The most definitive or the best test to tell if it's cancer or not is taking a biopsy. And like we've agreed before, biopsy can be taken by many ways. Whether you can do a fine needle aspiration cytology, or you can do a core biopsy, or you can do excision and send the mass basically for pathology. So here, in this patient, you might even expect that we've done a fine needle aspiration cytology, and the cytology sample is inadequate, or I can't report in this sample. So why this can happen? So this can happen for many reasons. So one of them is the radiologists have taken inadequate samples, or maybe a small amount of the tissue, so inadequate samples. That's why the pathologist is unable to comment on that. Two is there is an error in sampling it, or error in staining it, or error in smearing the sample or putting it on a slide, all right? So these are the errors that lead to inadequate results. Next question is, what is the most common type of breast cancer? So most common is, obviously you know that breast cancer it could be ductal cancer or lobular cancer, and both of them could be invasive or non-invasive. So the most common breast cancer is ductal cancer, invasive. So invasive ductal carcinoma is the commonest. So let's say we sorted that and the pathologist sent you the sample back. So what will be your approach of reading the report? So when you're reading the report, you're really interested to know a few things. One, what type of cancer is this? Or at the beginning, is this a cancer? Two, what type of cancer? If they examine the lymph nodes, so number of positive lymph nodes, how many lymph node positive that we could find in here? Also the margin status of this tumor, if we sent excision, right? So the margin status. In breast cancer specifically, we need to look into receptors as well. And the receptors we're looking into HER2 receptor, estrogen receptor, or progesterone receptor, and Ki67 receptors as well. So these are the three receptors that we're looking at. So you might be asked next what's HER? So it's called human epidermal growth factor receptor 2. And the reason why we're interested to know more about human epidermal growth factor receptor 2 is because there is a certain medication, because this basically have very bad prognosis in patients with breast cancer. And also there is a certain medication that's called trastuzumab, that works on the human epidermal growth factor receptor 2 and basically block it. When this happens, there's a sort of expression of tyrosine kinase activity. All right. So if this is inhibited, so we're going to inhibit the cell cycle. And if you inhibit that, so you inhibit the growth of the tumor. Okay. So trastuzumab works by inhibiting the human epidermal growth factor 2, and this goes inhibition to the cell cycle as well. So you've done excision, and you've done clearance of the axillary lymph nodes as well. What else would you like to do for this patient? So you can do really one of three things for treatment for the breast cancer. One of three things. So you can either give chemotherapy, you can even get radiotherapy, and finally hormonal therapy. You might be asked further about hormonal therapy if they are obviously hormonal positive, which is estrogen or progesterone receptor. So it really depends on the age of the patient or the menopause. So if it's premenopausal or postmenopausal. For premenopausal, we can give something called tamoxifen. Postmenopausal, we can give something called anastrozole. So now we got exposed to three different medications: tamoxifen, anastrozole, and trastuzumab. So trastuzumab is a tyrosine kinase inhibitor, or a human epidermal growth factor inhibitor. And for the hormonal receptor, we have anastrozole postmenopausal and tamoxifen premenopausal medication. So sometimes if those patients, so for breast cancer, one of the most common metastases is going to the vertebral column. The reason why this happens is there is sort of veins between the breast and the vertebral column, and these veins don't have any valves, so it's not valveless veins. So the cancer cell can easily move backwards to the bone. And if this happens, obviously we do have in here the spinal cord. It might cause sort of compression of the spinal cord. And if this happens, it will be very painful and lead to some neurological symptoms. But most importantly, it's very painful. So the way we treat this, we basically direct some sort of radiotherapy to the tumor mass. How it works? How does the radiotherapy work in this area? So one, it decreases the osteoclastic activity, and works in the DNA of the bone cells or the cancer cells, and basically kill the cancer. When this happens, so the compression of the surrounding structure will decrease, so the pain will decrease, and also the compression on the surrounding structure, including the spinal cord, will decrease as well and relieve the patient's symptoms. So there are many questions to be answered about breast cancer. It's a quite a topic, but generally these are the questions that are very high yield, potentially for exam setting. Thank you.